Okay, I want to welcome everyone. I want to thank all of you for taking time to join me. Those of you that are part of the Kondrot program, either the in-office program, which unfortunately is put on hold because of the COVID virus, and many of you are now part of the home program, which we've had great success with. And we are going to be expanding the home program to include reprogramming of your machine. It's very exciting. Ning Wu, the brilliant engineer, has now changed some of the software that we can actually change some of your frequencies on the microcurrent machine and maybe add programs and protocols without you sending the machine to the office. So will be available at no charge for those of you that are signed up for the year program. But those of you that are in the home program, that's the 3-month program, there will be a nominal charge for the software and cable. So give the office a call for more information. So let's see, let me get back to the beginning here. So we're going to be talking about light. And there's been several questions from you regarding light therapy, which is part of the Kondrot program. And I'm a big advocate of using light to help restore your vision and improve your health. So I'm going to begin by talking about sunlight. You know, the sun is the source of all of our life. Without the sun, none of us would exist. We would not have food. The planet would not exist. So the sun, there's a process called photosynthesis that the sunlight, the energy of the sun is transferred into the plants through a process called photosynthesis. So when you're eating plants or you're eating food, you're eating the energy from the sun. You're actually eating electrons. And, you know, we've all heard the fact that you need to keep an alkaline pH. And what does that mean? Well, when you have an alkaline pH, your body is rich in electrons. And electrons are necessary for life. If you have a depletion of your electrons, you become acidic. So one good way of maintaining this alkaline pH is by eating healthy organic food. And all of you know that I'm really a big advocate of, you know, shifting your diet more towards organic raw vegetables. Each one of those vegetables that you see there is loaded with the energy from the sun. And if you eat the raw fruits and vegetables, you're actually absorbing the energy from the sun. You're absorbing those electrons. And that's one of the best ways to help your body regenerate, maintain an alkaline pH. Now, it's interesting. I talked about photosynthesis. And on the left, there is a molecule of chlorophyll. And on the right, excuse me, I'm losing my voice. On the right is a molecule of hemoglobin. Now, chlorophyll is essential for all of the activity of plants. The ultraviolet light is absorbed into the plant and it produces a chemical reaction with the chlorophyll. Now, on the right is hemoglobin. And many of you are looking at this slide and you're saying, Dr. Kondrot, there's really not much difference. And there isn't. The structures are very, very similar. But if you look on the left, chlorophyll has
we don't see the chart, Dr. Kondrot.
Are you on your computer or are you on the telephone?
On the telephone.
You're not going to see anything on the telephone. You have to be on your computer. But I am recording this, so you'll be having that. So those of you that called in by the phone, I really encourage you to call in on your computer, or there is an app called GoToMeeting, which you can download on your phone, and you can see these slides. So anyway, on the left is a molecule of chlorophyll. On the right is a molecule of hemoglobin. And they're almost identical, except the center of chlorophyll has magnesium and the center of hemoglobin has iron. So I think this is fascinating that our bodies are very similar to plants, that a plant absorbs sunlight, the ultraviolet light, and converts it to energy through chlorophyll, through photosynthesis. And our body has hemoglobin in the blood. And the hemoglobin actually absorbs the ultraviolet light. So, you know, sunlight is very, very valuable for us in terms of regeneration and health and energy. Now, there's a brilliant doctor, Dr. Tina Karu. She's Russian. I had the pleasure of meeting her. She wrote a book on photosynthesis and light energy. And she has identified that in the body, there's something called cytochrome C. That cytochrome C, when an electron absorbs the cytochrome C, it starts something called the electron transport chain. And this is essentially energy production. So the point I'm trying to make is that when photons hit your body, when photons are absorbed into your body, it stimulates cytochrome C, which causes this chemical reaction, which is a source of energy. And on the surface of our body, we have tiny capillaries. So when you go outside in the sun, the sunlight is penetrating these capillaries, kind of impregnating the hemoglobin, stimulating the hemoglobin and causing an energy reaction. And I know that sunlight has gotten a bad rap. You know, we're told to avoid ultraviolet light, avoid the sun, but actually we do need a moderate amount of ultraviolet light. Matter of fact, one of the most important treatments that we do is something called ultraviolet blood irradiation. And what we do is we take out some of your blood in your body and we pass it through a very powerful ultraviolet filter, which essentially purifies, not purifies, it stimulates those hemoglobin. It stimulates the hemoglobin, energizes the hemoglobin. It's also a powerful disinfectant, energizing your body, helpful for rejuvenation. So this is one of the types of what we call oxidative treatments. In addition to ultraviolet blood, many of you are using ozone eye drops, maybe rectal insufflation or auricular. This is all type of an oxidative treatment in which we're putting electrons into your body, either electrons through the ultraviolet light or electrons through a highly reactive form of oxygen. So vitamin D is essential. And believe it or not, vitamin D deficiency is probably one of the most common medical problems worldwide. And the reason for that is people are not getting enough of sunlight. Now, I want to caution you because, you know, an excessive amount of sunlight can be harmful to your body. And this depends on where you live and your skin type, many, many factors. For example, when I lived in Phoenix, Arizona, I was at 2,000 feet above sea level and the humidity was about 10%. So the sun was extremely powerful, and by golly, you got a bad burn if you were outdoors on a bright, clear day. But on the other hand, in Florida, we're at sea level. We got high humidity, a lot of clouds, so there is a variation in the amount of sunlight that you need. So the point that I'm making is we do need ultraviolet light. We do need sunlight, and it's essential for our health. One of the light therapies that we do is something called Syntonic light therapy. And all of you that are a part of the program, you're given a spectacle with a certain wavelength of light. And the Syntonic light therapy has many, many functions. And one of the most important functions, it helps to balance your body. And you see here, this is called the physiological balance. And health is maintained when you have a balance. The green is the center. So if you have inflammation in your body goes more towards the red side or the sympathetic side. As you get older and you have decay and atrophy, you go more towards the blue side. So the light therapy helps to balance your autonomic nervous system. We want to push you more towards the center. So if you have dry macular degeneration, you have optic nerve disease from glaucoma, we may want to stimulate your body using light more towards the left or the red spectrum. But if you have inflammation, if you have iritis, conjunctivitis, or wet macular, we want to use the blue side. And also this balancing the autonomic nervous system, I think, is really essential for helping us regain our health. If the autonomic nervous system is not balanced, it's almost impossible for the body to heal. Of course, there's other ways to balance the autonomic nervous system. Meditation, prayer, positive affirmations, relaxation, anything you can do to balance. But light therapy is extremely a powerful way. You know, it's very, very relaxing when you're at the ocean, the water's blue, the sky is blue. It tends to really relax your body. So this is patients in our practice getting syntonic light therapy. So specific wavelengths of light are shined into the eye. Now, what makes this really remarkable is that when light goes into the eye, the retina is transparent. So when an eye doctor looks into your eye with his light, he actually sees blood vessels. So when you're doing this syntonic light therapy, it's extremely powerful because the photons of light actually hit the blood vessels, hit the hemoglobin, and are absorbed into your body. So it's truly, truly an amazing therapy and very powerful. So don't neglect your light therapy, those of you that are doing it. It works very well. It's a nice complement to the microcurrent therapy. Now I want to talk a little bit about the effects of light on the body. Well, there's one on the atomical level, on the atoms. When I was in college, getting my major in chemistry, we had something called spectrophotometry, that every atom in every molecule gave off a certain wavelength or spectrum of light. So light has the potential for selective activation of body chemicals. And we're beginning to discover this, that a certain frequency of light can maybe stimulate, like I mentioned earlier, cytochrome A, which is the electron transport chain. And light can also influence different neuroendocrine functioning. That's one of the reasons why if you don't get enough light in the wintertime, you get seasonal affective disorder. So specific wavelengths of light have a powerful effect on different body chemicals. There's also an effect on the cellular level. So each cell is stimulated by light. The organelles, the mitochondria, and Tina Carew, as I mentioned earlier, researched that light alters metabolism, causing cells to regenerate and to survive. So one of the effects that you have when you're doing light therapy like Syntonic or maybe some of the other ones I'm talking later, as you're looking at that light, those photons are actually causing a chemical reaction in your body, which is pretty amazing. Light is also very effective for stimulating regeneration for wounds, inflammation, ischemia, changing the acidic state. So in other words, we're changing that acidic state more to an alkaline state to help regeneration. Light also drives the organism for a balanced pH and vitality, and also light kind of maintains that balance. So there's been numerous articles published showing that low-level laser therapy can be very helpful for macular degeneration and glaucoma. And it's used by dentists, orthopedic doctors, physical therapists, which unbelievable number of publications. But in particular, I've been interested in studies that have demonstrated that light therapy can benefit macular degeneration and glaucoma and other eye diseases. And Dr. Tina Carew's work has demonstrated that there's very little difference between coherent light, laser, and normal light, like from a light bulb. Light is light. The only difference is the laser may have more deeper penetration and a higher intensity. Now, one device that I'm very, very fond of is the delta laser, or the Kondrot therapy. And the reason why I like the delta laser is that it has 4 combinations. It has the infrared laser, which is the red infrared laser. It has the 3 basic colors, which are the Syntonic treatment. It has a magnetic field, and magnetic energy is essential for healing, and also ultrasound or sound. So this combination of 4 properties kind of potentiates this delta laser. And it's a big part of my practice, the delta laser. There's been some work that published studies of photobiomodulation, regeneration without risk. And this is essentially a non-invasive way. This article had to deal with the application to regrow teeth, but there's been studies showing that can help regenerate the eye and the optic nerve. And this is a recent publication in one of the journals, a controlled study which compared treated patients and non-treated patients, that photobiomodulation was beneficial in the treatment of age-related macular degeneration. It's also exciting. There is a laser now available. It's a subthreshold nanosecond laser, which uses red light, a specific frequency of light, that we're actually applying this laser to certain areas of your eye. This is called the 2RT laser. We have this available in our office. So you can see that there's many, many different applications of light, from simply the benefit of light, getting sunlight in your body, improving the overall health of your body, from using something like Syntonic light therapy, which all of you are using in the practice if you're part of the program, and also more specialized lasers like the delta laser. And now we have an actual laser that we can administer focal laser treatments directly to the retina in a characteristic pattern which can help regenerate the eye. So light therapy is a very, very big part of the Kondrot program, and I hope all of you are utilizing it as part of your treatment. And this is a photograph here of a patient on the right. You can see there's a lot of drusen, and the drusen is one of the earliest changes of macular degeneration. And this is after the 2RT laser, which uses a type of red infrared light. And you can see the decrease in drusen. And the national study showed that people who had this light therapy had a 70% reduction in progression of dry macular degeneration, which is very, very exciting. So if someone tells you nothing can be done for your dry macular degeneration, there is many things that can be done. So I hope all of you, if you're part of the program, you do have a copy of my book, but if you don't have a copy of the book, make sure you download it. You can go to kondrotbook.com. I do have chapters on light therapy, and I go into a little bit more detail about what I talked about in this talk. Also, those of you that are listening that are not part of one of the Kondrot programs, I'd be happy to review your records. You can go to www.freeconsult.us and set up a time where I can talk to you and review your records. And this is the contact information, healingtheeye.com, our phone number, 800-430-9428, or email me at info@healingtheeye.com. So what I'd like to do now is to open the lines up for questions. And you have to excuse me, I'm losing my voice here. So there's a couple of ways you can respond. Those of you that are on the computer, you can chat me a question. There's a little chat box. And the rest of you, you can just unmute your computer and ask me a question. So the lines are open now for questions.
Dr. Kondrot, could you hear me?
Yep, I hear you fine. And if you could,
very good. Can you
please tell me
if
name?
the laser? This is Barbara Field from the Villages.
Yeah, hi Barbara.
Hi there. Does the delta laser affect or is helpful for diabetic retinopathy?
Let me repeat the question. You wanted to know, does the delta laser affect diabetic retinopathy?
Yeah.
Actually, the delta laser is a very versatile tool, much like microcurrent. There are certain protocols with the delta laser to help
stimulate. I can hear you, Mom. I can hear you. Yeah.
To help stimulate the pancreas to improve insulin production. The delta laser is also very valuable in treating neuropathy and improving circulation in diabetes. And it is also very effective for treating diabetic retinopathy. But all of these treatments should be done under the supervision of a medical doctor. I do feel that the microcurrent, the application of the microcurrent may have a little bit more specific treatment, a little bit more specific affinity or protocols for the given tissue. See, the delta laser, we're only dealing with one wavelength of light. When we're doing the microcurrent, we're fine-tuning it with different frequencies to match the tissue. So to answer your question, the delta laser is a very effective treatment for diabetic retinopathy. Matter of fact, there have been numerous studies demonstrating that it does have a positive effect. And if you want more information on the delta laser, don't hesitate to give our office a call, and we can send you more information. And I do have a couple of articles, and I believe I even have a YouTube video on the delta laser. So we can send you those links if you want more information.
You have a second laser now that you're talking about today?
Well, in addition to the delta laser, well, number one, the primary treatment is Syntonic light therapy. It's a very simple treatment, very powerful and beneficial, and it doesn't require expensive equipment. We have the delta laser. The third is something called the 2RT. This is a laser that's just been approved by the FDA, and it actually focuses. It takes certain wavelengths, nanoseconds of light, and it treats the retina inside the eye. So this is not like the typical laser that maybe you heard about eye doctors are using. You know, the laser that they're using now for diabetes and other problems actually burns the retina, actually destroys retinal tissue. It destroys a little blood vessel. This laser helps regenerate, helps restore the function of the retina. So in other words, it's a type of light therapy very similar to the Syntonic light therapy and the delta laser, but maybe it's delivered in a more powerful and focal form directly to the tissue we want to regenerate.
The Syntonic light therapy that I'm doing every day, can I do it more than one time a day?
I really don't like you to do it more than once a day. More is not better.
Okay.
We want to gently stimulate the body. Sometimes maybe you can do it twice a day, but generally speaking, only once a day. Now, also, I want to caution you, make sure you only do the light therapy during the day. When the sun sets,
Right.
do not do the light therapy because that could interfere with your circadian rhythm. There's a certain rhythm of light. Now, of course,
Right.
during the winter months, which unfortunately we're going into, the days are very short. And so you could probably do the light therapy anytime between 8 a.m. and 8 p.m. because some of you are living in
Okay.
northern latitudes where maybe you only have 4 or 5 hours of daylight. So between 8 and 8, do the light treatments. I think you're probably better off focusing the time for your treatment with the microcurrent. Microcurrent, as far as I'm concerned, is probably the most effective modality that we use to help regenerate. And I'm very excited because now we have a way of reprogramming your machine, subtly changing the frequencies and also maybe the current too, maybe changing the level of the current, either lower or higher. And all that can be done online now, which is nice. You don't have to come to the office or you don't have to ship your machine. So you can contact the office and they can give you information on that.
I do that daily.
So there's a question on the chat. Is any light therapy effective for treating epiretinal membrane? And to Alan, who asked that question, the Syntonic light therapy and the delta laser, both of those can be effective. But I would have to advise you on the specific wavelength of light that would be beneficial, depending on the extent of the epiretinal membrane and what is going on. But once again, the number one treatment I feel for epiretinal membrane is the microcurrent. We have specific frequencies that have seemed to benefit the epiretinal membrane. And those of you that are interested in my research, you can go to Kondrot articles. That's all one word, kondrotarticles.com. And I have a list of my publications and research articles that if you're interested in a specific disease, then you could look up that disease and look at the treatments that were done.
Dr. Kondrot, can you talk about the treatment that you mentioned reduces the dry macular degeneration, as opposed to I'm calling for my mother. She's doing the light therapy, of course, in your microcurrent machine, but you just mentioned there's something else now that helps reduce this dry macular degeneration.
Yeah, it's
and is
very
that something
exciting.
you're offering?
It's very exciting. This laser was just approved by the FDA. It's called the 2RT, 2 Romeo Tango. You can probably research it on Google. We have that laser, and we are using it on a select group of patients. It's only for people who have a certain type of dry macular degeneration. But the studies have shown that it reduces the progression by greater than 70%, which is phenomenal. But
is it reducing the drusen?
Well,
or is it
microcurrent can reduce the drusen, and the delta light therapy and the Syntonic light therapy. Changing your diet can reduce the drusen, detoxifying your body. Drusen, I describe that as your retina being constipated. And, if your body's constipated, what's the best way to get rid of your constipation? Well, exercise, drinking a lot of water, improving your metabolism. So essentially, all these therapies that we're talking about, the microcurrent, the delta laser, the Syntonic laser, helps to improve the metabolism of your body. Now, the 2RT is just a laser that has been studied by the FDA and has been approved, and it's very promising. I'm not saying that the 2RT is better than microcurrent or Syntonic or the Delta laser. It's another tool that we have that we can offer you. But the thing that really excited me about the 2RT laser, it uses the same technology that we're using. It uses light. It uses certain wavelengths of light to help regenerate the eye. So it supports this whole idea that light is a powerful means of regenerating the body. Okay, any other questions? You can chat your question into me in the chat box, or you can just chime in. And those of you
Dr. Kondrot. Oh,
go ahead.
hello, Dr. Kondrot. It's Amanda from the UK. Could I ask you, please, about rectal insufflation? And do you think it's not something I'm doing at the moment? I haven't bought the equipment. Do you think it's something that's essential in the treatment for glaucoma?
Yes, I do think that the rectal insufflation can be a very valuable treatment, especially if you have a lot of damage from the glaucoma. You know, anything we can do to improve the oxygenation and help regenerate the eye, you know, let's do it. And of course, oxygen is necessary for regeneration. Now, there's two ways. There's the rectal insufflation, which I think is probably more powerful. There's also something called auricular, where you put a stethoscope in your ears and you pass the ozone gas into the stethoscope. So there are two ways. And of course, now with the COVID virus, my wife and I are doing frequent auricular and rectal ozone weekly to help strengthen our immune system. The ozone has shown to strengthen your immune system, and also it's virucidal, meaning that the ozone does kill viruses. You know, most of the swimming pools now, especially the Olympic swimming pools, they purify the water through ozonation. You know, ozone kills the bacteria and viruses. So not only does it kill the bacteria and viruses, but it also is a powerful effect for stimulating rejuvenation. And of course, one of the causes of damage in glaucoma is decreased oxygenation to that optic nerve. And anything we can do to improve the oxygenation, let's do it. So, you know, the microcurrent improves the blood flow, stimulates cellular metabolism, and the ozone helps improve the oxygenation. So I would definitely highly suggest that you consider the ozone.
Okay, thank you very much.
Thank you.
Dr. Kondrot?
Yes. And who's talking?
This is Mary. I don't know, was somebody else talking?
No, you're on, Mary.
Okay, thank you. Yes, you had mentioned the green light therapy with the green glasses. I guess it's just a regular light bulb with the green glasses, but that's what I'm doing. But you had mentioned a more red side for certain conditions, and so I'm just wondering if
you know, it's if you ask your eye doctor, can light therapy help my glaucoma? He'll probably laugh at you. But in 1948, in the American Journal of Ophthalmology, which is a prestigious peer-reviewed journal, there were 2 articles published showing that green light therapy can benefit patients with glaucoma, not only lowering their pressure, but improving the function. Now, since that time, we have found that different variations of green light. So you can have green red, you can have green blue. It has a different effect on the eye. So plain green light may not be as beneficial as maybe one of the Syntonic colors, you know, green orange or green red. It depends on your autonomic nervous system. So we would have to evaluate you to determine the best possible color. Also, it depends on intensity of the light. brighter light or more light is not better. There's a certain intensity of light that seems to have the optimal effect. So you have to be careful. It's not like you can put on a pair of green glasses and go outside in the sunlight and expect a beneficial effect. So, researchers have demonstrated there's a certain intensity of light that has the best benefit. And that's essentially, there's an organization called the College of Syntonics. It's a group of eye doctors. I'm a proud member of the organization. And they have studied the application of light therapy for eye disease for the past 75 years. They have their own journal. They've written textbooks on the subject. So there's been quite a bit of research on, specific light therapy. So it's not just getting green light that's going to benefit you.
Okay, I'm wondering if I should talk to you about that again, because for this time of the program, I have been using the green, the glasses, and then actually looking at the light bulb under the goose light lamp. And
the light you're using, is there a name of the light? Is it mu delta, mu epsilon? We have a name for it, the light.
Okay. I got it from your office.
Okay, well then probably it's the right wavelength of the light. But I'd be happy to review your records and see if we could maybe fine tune it or make some suggestions for you.
Thank you.
Thank you.
Dr. Kondrot, are you able to talk about when you wear eyeglasses and they're putting in a blue light, you can protect your eye from the blue light now. Is that okay to have in eyeglasses if you've got the macular degeneration or cataracts, or is that?
That's a really good question, and I should have talked about that during my presentation. Blue light is dangerous at night. There's been some research done to show that blue light maybe increases the incidence of cancer, diabetes, and a host of other problems. Blue light at night is dangerous. We need blue light during the day. That's why God made the sky blue and the ocean blue. We need blue light during the day. At night, when the sun sets, we shift more towards the red spectrum. So blue during the day, red at night. In fact, the iPhone that I have, the engineers at the Apple company now have what's something called a night shift. During the day, my cell phone is blue, but at night it turns to a reddish tinge. So to answer your question, we do need blue light during the day. Do not wear blue blockers during the day. You should wear blue blockers at night. You want to avoid blue light at night. Those of you that are listening, you may be wondering, well, what are blue blockers? Well, blue blockers are an amber colored lens. Shooters and sportsmen wear it to help reduce the glare, and it blocks the blue light. So do not wear blue blockers during the day. I advise you to wear them at night. We do need blue light during the day, but not at night. So
they're putting blue light protection in regular glasses, like your readers you wear during the day, or your regular progressive glasses or bifocal.
I don't recommend that. We need blue light during the day. We need the blue blockers at night. That could be harmful for your eyes.
Okay, so to have maybe 2 pairs of glasses.
Or maybe just have a clip-on. You can have a clip-on or have 2 pair of glasses.
Mm-hmm. Okay.
But that's a very good question.
Dr. Kondrot, what if you sit in front of a computer all day, which is why we have the blue light blocker for the computer blue light?
No, you don't want to use a blue blocker during the day, but if you're using the computer at night, put on the blue blockers.
Okay.
You need blue light during the day because that blue light is essential for the function of your body. And remember, the blue spectrum goes towards the ultraviolet light spectrum. So sunlight is ultraviolet light, the blue light. But at night, avoid the blue light. Unfortunately, our federal government is pushing the compact fluorescent lights on us, which give off a blue spectrum. And there's some researchers that feel that this could be catastrophic to our health. You know, the old-fashioned incandescent light bulbs, which give off a red spectrum, is much better at night. Blue light, you should avoid blue light at night.
When you're outside, how long, if you're like taking a walk and you know, it's an hour or so, midday, do you recommend no sunglasses then for someone with the?
Well, after all my research, I was always the type of person, as if I was walking across the street, I'd put on a pair of sunglasses. That we do need a moderate amount of ultraviolet light. So the only time I wear sunglasses is if I'm going to be on the beach for a long period of time, or hiking and it's a sunny day, then I'll put on my sunglasses. But most of the times I do not wear my sunglasses. But see, it depends on where you live. I know if you live in Phoenix, Arizona, at noon on a sunny day, you can't even walk across the street without the intense glare of the sun. But in Florida, on a cloudy day and high humidity, the sun is much more tolerable. So it really depends on your altitude, depends on the humidity, and also depends on your skin. You know, if you're very fair skinned, you're not going to tolerate light as much. So there really isn't any, you know, good rule to follow. All I'm telling you is that we do need a moderate amount of sunlight. You know, one of the biggest deficiencies that I mentioned is vitamin D. The reason why everybody's deficient in vitamin D, we're not getting enough sunlight. So we need sunlight for the health of our body. And you can be tested for your vitamin D levels. And those of you that maybe don't get outside as much, or you live in a really cloudy climate, you may want to start taking some supplemental vitamin D.
Dr. Kondrot, you mentioned on one of your DVDs that fish oil is not a good source of omega-3 for the eyes.
Yes, I'm not a big advocate of fish oil. We need omega-6s and 3s. They're essential for the eye health and the brain. But there's 3 problems with the fish oil. Number one, it's a derivative oil. You know, the fish eat plants, and then that's metabolized into that particular fish oil. Also, fish oils have a high level of mercury and toxins. And the third thing is that it's been shown that the fish oil is not utilized as readily by the cells as the plant-based oils. So Dr. Rowan, a good friend of mine who's a brilliant alternative doctor, wrote a book with Professor Peskin on the dangers of fish oils. So if you're interested in more on that topic, I would read that book. So I am a big advocate. We need essential fatty acids. We need omega-6s and 3s, but they should be in the form of plant-based oils. And that's one of the reasons all my vitamin formulas have plant-based oils, no fish oils.
Excellent. Now, so how would that extend to, so that would you recommend I not eat so much, say, salmon?
Oh, no, it's okay to have, you know, fish in your diet. Of course, you know, I'm a big advocate of a vegetarian, organic, raw vegetarian diet, but, you know, eating fish occasionally is fine. I would just be very careful, you know, to avoid the fish oils.
Right. And have you ever heard of yellow fat disease? Because I just came across that, and I just on preliminary reading, you really don't want to eat too much fish.
Yellow fat disease. That's a new one. Maybe if you could email me a link to that so I could do some reading.
Okay. Okay. And back to the, well, I don't want to take you off topic what you're going to say, but back to the eyes. When you're talking about skin color, eye color is important too, no, for amount of sun exposure. Like,
oh yeah,
if you have brown eyes,
that's
you have more protection than blue.
Because you know, African Americans, they have heavily pigmented eyes, and it seems like they have less damage to their retina than Caucasians who have very light blue eyes. You know, the incidence of macular degeneration and cataracts are much higher in blue-eyed Northern European. You know, when I did a lot of my missionary work in Africa, you know, macular degeneration is rare in Africa, mainly because the eye is so heavily pigmented. And even though they do get a lot of sun exposure, they just have less damage to the eye. So you're right. The pigmentation of the iris does have an effect too, in the amount of light that your body can tolerate. But you know, anything in excess can be damaging to your eye. You know, too much water can kill you. Too much oxygen can kill you. So there has to be a balance.
And speaking of oxygen, you're talking about the ozone usage. I don't know if anywhere in any of your literature or stuff you talk about breathing, because of course you can quickly improve your oxygenation by breathing techniques.
Oh yeah, you know, deep breaths. Taking a deep breath is very beneficial. It also, not only improves the oxygenation, but it helps relax your autonomic nervous system, helps balance your autonomic nervous system. And of course, exercise increases your oxygenation too.
Dr. Kondrot, does cod liver oil, is that considered also one of your fish oils?
Cod liver oil
that you
is also
consider
a fish oil.
manufactured, or is that different?
Cod liver oil is also a fish oil. So
Okay.
You want to avoid that. I mean, you know, a small amount is okay, but there's a lot of people that are just gulping it. And I think it has a toxic effect on the body.
Dr. Kondrot?
Yes, and
I have a
who is this?
question. I just came across something that is a potential breakthrough in treating macular degeneration, and that's restoring the correct balance of natural hormones that decline with age, that can retard and possibly even reverse the progression of macular degeneration. Do you know anything about that?
Oh, yeah, well, that's nothing new. I think hormonal balance, you know, many times when you have hormonal changes in your body, you're going to see changes in your eye. So many alternative doctors are balancing the hormones. So, for example, if you're low thyroid or estrogen or testosterone, you need those hormones balanced. But the question is, what is the
that was something that I recall. That wasn't anything I recall you're mentioning in any of your conferences. So I just came across that.
No, that's something that's
to...
important. And when I do take your homeopathic examination, I do question you about health issues and other issues. So, for example, if you're very tired and you have trouble sleeping at night, these things may point to a hormonal imbalance. So we do look at those things. But, you know, getting back to basics, let's say you have a hormonal imbalance. I think that by shifting your diet more towards organic raw food, keeping yourself hydrated, balancing your autonomic nervous system, that can treat your hormonal imbalance. In other words, you know, there's a whole school of thought is that you treat the end product. So if you're low in estrogen, you take more estrogen. Well, why not looking at why you're low in estrogen? Maybe you're under stress, maybe you have a poor diet, maybe you're dehydrated. You understand what I'm saying?
Or maybe you just don't have any hormones left in your body. You know, when you're past menopause, there's not a lot there that you can rely on as far as hormones.
Right. Well, you know, there is a whole group of doctors called functional doctors. These are doctors that look at the hormonal balance. And you might want to get in touch with a functional doctor. They look at your thyroid levels, your estrogen, progesterone, you know, adrenal cortex, and they help balance that.
Yeah,
but you're right.
That sounds good.
But that's nothing that's new. You know, doctors have been treating that aspect of the disease maybe for the last 20 or 30 years. to a different extent.
Okay.
Okay,
Thank you.
Now, I'm always looking for topics. I think next month, we have these meetings the first Wednesday of every month. Next Wednesday, I'm going to be talking about vein occlusion, vascular occlusions, and hemorrhage in the eye. There was a patient that had an interest in the vein occlusion, so we're going to talk a little bit about that. And I'm also interested in any other topics that you may have for me to address.
The ozone, doctor. Can we talk about ozone?
Okay, maybe I'll put that on my list. I have given many, many webinars on ozone. You can search on YouTube, but it may be a good time to kind of refresh everybody on the types of ozone. In fact, I gave a talk. I interviewed Dr. Robert Rowan, a podcast where we talked in detail about ozone. Give the office a call and we can send you that link. I think you'll find it very, very interesting.
Dr. Kondrot, on your Oculomed box, it says shake well before each use. But on the enclosure, it says shake bottle gently, side to side only. And then in large caps, it says do not shake up and down. I was just curious, what is the problem with shaking it up and down?
I think maybe you're getting some bubbles in the solution, or maybe you're changing the concentration, but that's the first time I heard that about shaking it. I mean, it should be gently, shake gently, not vigorously.
Yeah, it's on the outside of the box, it says shake well, but when you get the insert, that's when it says side to side.
Okay, well, that's really not my product. We're going to have to address that to the pharmacy company that makes it.
Okay. Thank you.
Okay.
Dr. Kondrot, I have a question.
Yes. Hi, Carolyn.
Hi. Have you spoke in detail about the raw food diet for older people and with digestion and all? Maybe
well,
there's something.
Probably the first third of my book, The 10 Essentials to Save Your Sight, deals with diet and nutrition.
Mm-hmm.
So I would definitely get a copy of that.
Okay,
and,
I'll look at it.
I have a couple lectures on webinars, but I'm a very, very big advocate. My wife and I are pretty strict vegetarians now, and I probably have more energy and I'm sleeping better. My blood pressure is much lower just by shifting my diet towards organic raw. But I occasionally have some meat, but generally speaking, I'm pretty close to 100%, raw vegan.
Then what supplements do you suggest, like DHA and vitamin B12?
Well, you need to buy B complex vitamins if
Yes.
you're on a vegetarian diet, and many people have a metabolic deficiency. They have a detox deficiency where they do need vitamin B12. In fact, most people that I examine that have macular degeneration have that defect in B metabolism. So you do need the B complex vitamins. So they're in all of my vitamin formulas, the B complex vitamins. And sometimes you do need to supplement. I'm a big advocate of the Mars cocktail, which is a vitamin cocktail that you can get intravenously. But remember, the best way to get our nutrition is by the food we eat. But unfortunately, it's getting tougher and tougher because of quality of our food that exists.
Thank you.
Okay, well, we're coming to a close. I want to thank all of you for joining me. Remember, next Wednesday, the first Wednesday of every month. And for more information, give the office a call. And this is Dr. Kondrot wishing all of you good health and clear vision, and stay healthy and safe. Take care now. Bye.
Thank you.
Thank you.
Bye.
Thank you.